just to summarize, graft-versus-host disease is one of the most common adverse events after allogeneic transplant. Acute takes place earlier, the first 100 days or so. Chronic takes place later. Acute is acute, inflammatory, T-cell driven. Chronic is more of an autoimmune fibrotic phenomenon. Acute affects approximately 40 to 80% of patients. Chronic affects approximately 40 to 50 to 60% of patients. Many variables affect the incidence of acute graft-versus-host disease, the severity, and other prognostic indicators. The treatment for both, the first-line treatment is usually corticosteroids. For acute graft-versus-host disease, the initial dose most of the time is 2 mg per kg of prednisone or equivalent. It's easy to know earlier on whether patients will respond or not. 50% generally will respond, 50% will not respond or respond but become dependent on the steroids. The second-line treatment and the only FDA-approved second-line treatment for steroid-refractory acute graft-versus-host disease is ruxolitinib. And again, the response rate is approximately 50%. You can tell from my summary, I'm semi-excited, semi-optimistic. In the past 50 years or so, since the inception of allografting, there was nothing better to add to glucocorticosteroids. Now that we have ruxolitinib as an approved agent that was confirmed in a state-of-the-art phase 3 trial, that is a lot of excitement for our community, but we want more. You still have 50% of patients that do not respond. You still have people that respond initially and then they flare up and they lose that response. Even for the responders, the intense immune suppression leads to increased mortality, 50% treatment-related mortality at 6 months, 60% treatment-related mortality at 1 year. So the picture is not so good. I'm shy of saying dismal. Chronic graft-versus-host disease, we have nothing better than steroids at this point, but there are a lot of other agents in the pipelines. We are running a multitude of trials and various treatment modalities. So I am optimistic that soon enough we will have a couple of other agents for these two very difficult to treat diseases.